Happy Wednesday evening. I'm your host, Shameika Rhymes, and welcome to Soulibration. Let me know where you are watching from and how you're doing this evening. Let me know how your week has been going so far. Remember to share this with your network. And if you have any questions during the show, make sure you drop it in the chat because we love having the interaction with you guys. We want to make sure your questions get answered while we have the experts here. So tonight, November is National Healthy Skin Month. So tonight we're taking a look at seborrheic, I keep messing this word up, seborrheic dermatitis, also known as sebderm. So you'll hear me just say sebderm for the rest of the night because I'm not trying that word again. It's a common yet often misunderstood skin condition. And so board certified dermatologist Dr. Heather Woolery-Lloyd is joining me tonight to share her expertise on identifying the symptoms, understanding the underlying causes, and exploring the latest treatments. This can happen from the impact of weather and diet to even, we're going to talk about the best over the counter solutions. We're going to cover every single thing that you need to know about how to manage sebderm effectively. We're also going to take a look at how it can manifest on various skin tones and provide some insight to when the best time is to see a healthcare provider. So whether you're dealing with sebderm yourself or somebody in your family is, or in your friend circle or whatever, make sure you share this video with them. Let's see who we've got tuning in. We've got Charlotte in the house. Maryland, welcome, welcome. So let me introduce my guest tonight, Dr. Heather Woolery-Lloyd. She's a board certified dermatologist, and she's also board certified in lifestyle medicine. She founded Derm Friends. It's a platform that provides a reliable source of skincare education and expert recommendations for common skin, hair, and nail concerns. And she also serves as the director of the Skin of Color Division for the University of Miami Department of Dermatology. So let's welcome Dr. Woolery-Lloyd.
Hello.
Hi, how are you?
I am great. Thank you so much for having me. I'm excited to be here today.
Yes, I'm excited to talk about this topic because I suffer from this, and I was like, yes, we're finally going to get into this because it is very, I think, misunderstood. You too.
Me too. So this is really exciting for me because I think this is such an important condition for us to talk about and really raise awareness.
Absolutely. And for the people in the chat, let us know if you are suffering from this as well, because there's a lot of us out there that have the same issue. And I see that Greenville, North Carolina is in the house. So welcome, welcome. Make sure you drop your questions in the chat. So we're going to kick this off with the big question. What is sebderm?
So seborrheic dermatitis is an inflammatory skin condition. It's caused by inflammation on the skin, and the most common location occurs is on the scalp. So people will get itching, burning, stinging, and the most common, we'll also see flaking and scaling, right? That's the thing that you see on your scalp when you have seborrheic dermatitis. So it's an inflammatory skin condition. It's caused by inflammation on the scalp, but you can also see it on other parts of the body. So you can see it in the eyebrows, around the nose right here. So if you have a little dry scale around the nose, that's not dry skin. That's probably seborrheic dermatitis. You can get it behind the ears. I had sebderm when I was in medical school, and that's where I had it, a lot of scaling behind my ears. And then in men, you can even get it on the chest because it commonly occurs in hair-bearing areas.
Wow. Okay. So I do recall, and I'm always team TMI over here. So I was getting my hair done, and I remember my hairdresser saying, "There's something on your scalp," and I was like, "Take a picture of it." And when she showed me, I was like, "I don't know what this is," and it was the red scaly. And so I sent it to the dermatologist, and she immediately said, "This is what this is." And
Yes.
I'd never heard of it before. Can it appear like on other parts of your body that have hair, like, your legs or your arm or any places like that?
No, not really. It really is primarily on the scalp and the face. And like I mentioned, behind the ears. And then sometimes in men, we can see it on the chest. But those are it's really in the localized to those areas. But it's very, very common and affects, any age group. So from babies, cradle cap, you know how babies can sometimes get cradle cap? Yeah. That's seborrheic dermatitis, all the way to adulthood. So it can affect any age, all ethnicities. It's very, very common. I see it all the time in my practice. And it's very bothersome because no one likes to have scale on their clothes. No one likes to be, it's itchy, right? So the most
Mhm.
itch symptom is itch. So no one wants to be scratching their scalp, in a business meeting or something like that. So it really is very common, and it's something that we can treat. So I'm really glad we're talking about it today because it really does bother people. It can affect quality of life.
Mhm. Are there other symptoms that people should look out for? You mentioned the dryness here and back here and those things on the scalp. What about are there any other like telling symptoms that we should be on the lookout for?
So the main thing is, people will complain of flaking and scaling, so dandruff type scale on the scalp, and itching. That is a very common complaint, itching and stinging. I
Okay.
remember when I had seborrheic dermatitis in medical school, that was the symptom that bothers me the most. And in studies, that is the symptom that bothers people the most, is that itching, the sensation of itching on the scalp.
Mhm.
So it's something that you should definitely think about. If you have flaking, scaling, and itching, that all together makes us think about seborrheic dermatitis as a diagnosis.
So what is the difference between that and just plain old dandruff, or is it the same thing?
So what we say is that dandruff is a symptom of seborrheic dermatitis. So sebderm is this inflammatory skin condition, occurs on the scalp and the face. And when you have flaking and scaling, which is what dandruff is, basically the
Yeah.
flaking and scaling, it's a symptom of this inflammatory skin condition, sebderm.
Okay. Okay. So when should someone see a healthcare provider, and who would they go see? Would they go see a dermatologist, or should they start with their GP first? Or, I'm good for sending pictures to all my doctors, like whichever one can tell me what it is.
Don't worry, I get pictures all the time. So absolutely, it is something that's so common. Most doctors know what seborrheic dermatitis is. So the primary care physician can diagnose sebderm. Pediatricians can even diagnose sebderm because it's something, like I said, can occur at all ages. And
Yeah.
then, of course, dermatologists, we are the skin, hair, and nail experts. So we, of course, can also diagnose sebderm. So I think it's fine to see whatever physician, either your primary care, or if you have access or to a dermatologist, absolutely a dermatologist, to get treatment, because there are great treatments available.
Okay. And so do you just diagnose it just by looking, or are there some tests? Is it diagnosed?
So it's so common. It's something that most doctors can diagnose just by looking. If you have flaking and scaling on the scalp, itching, sensitivity, and that distribution. So I haven't really talked about where it can occur. So some people will just get diffuse scale throughout their scalp and itching,
Mhm.
but a very common presentation is around that frontal hairline, where
Yep.
you'll get it almost looks like a little scalloped border across the frontal hairline. I see that often in my patients. And it'll be scaly, and sometimes it'll be a different color. It can be hypopigmented in
Mhm.
darker skin types, so it'll be a little bit hypopigmented. So that's a little clinical trick that can help us diagnose.
Yeah.
Also, we'll look for other locations. So I'll often ask my patients, if they complain of scale on their scalp, I'll say, do you sometimes get scale in your eyebrows, around your nose, behind your ears? And once they say that, then, I definitely have that diagnosis. So it's a compilation of these things together, but it is very straightforward, easy to diagnose. And for most doctors, it's a very straightforward diagnosis.
Okay. I see we have a couple of questions. I'm going to just kind of pop these answer bring these up to you as we are going along. Shelly Morris wants to know, hi Shelly, is this condition a symptom of an autoimmune disease?
No, it's not autoimmune. It is inflammatory, which means that your immune system is kind of overreactive, but it is not autoimmune. It is very, very common, because autoimmune conditions in general are a little bit more rare. This is
Yeah.
more like a common inflammatory condition. You can think of something like acne. Acne is also an inflammatory condition of the skin, but not autoimmune. So it's not related to acne, but it's something that's easy for you to compare it to, and that this is an inflammatory condition, very, very common, affects all ages, all people, but not an autoimmune condition.
Okay. I know that Shelly's going to ask this question. She's my co-host on my other podcast, but I know she's going to ask this. So I'm going to go ahead and ask it before she does. She's going to ask if this can get worse with menopause. Aren't you, Shelley? You're going to ask that.
It can. So it can get worse with so many things. So probably the thing that characteristically makes seborrheic dermatitis worse is stress. And I do think menopause, I think your stress probably goes up a little bit during menopause. I remember, as I mentioned, I had this during medical school, and that kind of explains it. Since I've graduated, it kind of comes and goes. It's a chronic condition. It tends to come and go, but I definitely in my patients see it getting worse with stress. So that's one of the most characteristic things that we'll see. And then I practice in Miami, so we really don't have winter here, but definitely it can get worse with changes in the weather. When the weather gets a little more dry, the scalp can get more dry. You can get more flaking and scaling. So those are the things that I think of as being the biggest triggers, but by far, all inflammatory skin diseases, including seborrheic dermatitis, get worse with stress.
Okay. Because I think my dermatologist referred to, because mine would be like right here in between my eyebrows. And she just said it's a stress rash, and it started to pop up after my hysterectomy. And I was like, this has never happened to but the stress from just surgery and everything.
And
that
probably
makes
some
sense.
hormonal changes could influence it for sure, because hormones definitely influence like the hydration of our skin and so forth. So it could maybe kind of turn it on a little bit. I remember my sebderm was also bad after pregnancy. I remember right after I had the babies, I would get a flare of my sebderm. So that could be stress or hormones.
Yeah. We can't win. Lynette McCallum. Hi, Lynette. She wants to know, how does this differ from eczema?
That's a great question. So eczema usually is usually all over the body. It would be unusual for someone to only have eczema on their scalp. So that's one of the biggest differences. Eczema also tends to be associated with other similar diseases. We call this atopic diseases. So things like asthma. I would say allergies in the lung is asthma. Allergies in our skin is eczema. Allergies in your nose would be hay fever or allergic rhinitis. So people with eczema are more likely to have that more allergic type of either family history or personal history of eczema, asthma, or hay fever, allergic rhinitis. So that's one difference, is that it's associated with more of the allergic skin or the allergic skin and body conditions. The other difference is that eczema, like I said, tends to be all over. So it can be like in the angle of your like elbows right here, behind the knees, on the extremities, associated with very dry skin. So it's not common to have eczema only on the scalp. So that's how you would differentiate it.
Thank you for that, because that was a good question. Thank you, Lynette, for that. Can sebderm be mistaken for other skin conditions? And if so, what are some common misdiagnoses?
So the biggest one that has a little bit of an overlap is psoriasis. So psoriasis is an autoimmune condition, completely different, but it is an autoimmune condition, and you can get psoriasis on the scalp. So the really good question is, how can you distinguish sebderm from psoriasis? Because psoriasis can occur on the scalp. Unlike eczema, which can occur on the scalp, but usually is also on the body, you can have psoriasis mainly on your scalp. So how do we distinguish them? Well, psoriasis tends to be a little bit thicker scale, a silvery scale, very thick and adherent, tends to be slightly different locations, the back of the scalp. We call this the occipital scalp. And psoriasis, they might have a little drop of psoriasis on their elbows and knees. They might have a family history of psoriasis. They might have a family history of autoimmune diseases. So based on our physical exam of the severity, because psoriasis on the scalp is usually much more severe, a history of maybe a family history of autoimmune disease or family history of psoriasis or personal history of autoimmune disease. And then we would look, do you ever get any scale on your elbows and knees, which are classic locations for psoriasis? That would push us more towards psoriasis. So that's a skin condition that has a little bit of overlap, because psoriasis can occur only on the scalp, but it's much more severe. And people with psoriasis tend to have a family history of autoimmune conditions or personal history.
Okay, thank you. I feel like we kind of we touched on it a little bit because it's so common, but who is most susceptible to having sebderm? I mean, is it someone that may have a lot of hair, or somebody that just is prone to having dry scalp? Like, is there any reason,
Well,
rhyme or reason for it.
Well, like I said, it's very common. So there's no rhyme or reason. Anyone can get it, just like anyone can get acne. But we do see it commonly in African Americans. So it's the third most common condition in a dermatology clinic for African Americans. So it's something that I see in my practice all the time. And we also do a lot of things to our hair and scalp. So that could sometimes aggravate seborrheic dermatitis. So I think that in my personal practice, it's very, very common in African Americans. And in studies, it's the third most common condition in African Americans and people presenting to a dermatology clinic. But it really can occur in all ages. Remember, in babies, cradle cap is sebderm. You know, people can get flares when they are teenagers. Remember, we talked about that hormonal, you can get a little bit of a hormonal flare, and then well into adulthood. So we see it in all ages, all races, all ethnicities, but it is very common in African Americans.
Okay. We've got a couple more questions. Lynette wants to know, since this condition is more on your scalp, can it complicate alopecia?
Yes. So if you have a very itchy scalp and you're really scratching at your scalp, you can definitely get breakage and you can definitely get hair loss if you have severe sebderm. Especially, you remember I talked about that frontal hairline. So if you know, this is our most sensitive, delicate hair that breaks off so easily. So if you have a lot of scratching, a lot of symptoms, and you're scratching at your scalp, absolutely you can get breakage and hair loss in that area. The good news is that it's not permanent. It tends to be just breakage, not necessarily true alopecia where the hair is falling out from the root, but it is a possible side effect of severe sebderm, especially if the scalp is very itchy and the person is scratching.
Oh, okay. Because I didn't realize that. So I was just about to ask if you are constantly, like, if there's just a patch that's always itchy. Mine's always in the back, always scratching it. And then I noticed at one point the hair was breaking off there. Could
Yes.
it be because of that,
Yes.
the constant scratching back there?
Absolutely. It's just that mechanical trauma of scratching can cause the hair to break off. And then, of course, the hair is probably a little more flat, a little more fragile because it's growing out of an inflamed scalp. So it's not growing out of a healthy scalp. So definitely we'll see it. It's not a cause of traditional alopecia where you get that shiny, round, you know, hairless patches, but definitely a common cause of breakage.
Okay. Let's see. Vonnie Carroll, hi Vonnie, wants to know what natural remedies can treat this condition.
Well, you know, there are many treatments. I'm glad we're talking about treatment. I do want to mention, you know, although I do love natural treatments, sometimes the natural treatments can aggravate this condition. There was a period of time where apple cider vinegar was like a trend, and everyone was putting apple cider vinegar just directly on their scalp. And that can be a little bit irritating because it's a different pH than our normal skin, and it can be aggravating. So sometimes the home remedies when it comes to sebderm can be a little bit aggravating because things that are acidic or are alkaline that can aggravate the scalp will aggravate sebderm. So typically as a derm, I will recommend either over-the-counter products that you can buy at your local pharmacy, but typically I'm writing a prescription because there's a lot of great prescription options.
Yeah, that reminds me of what I don't know the name of it, but it was more like it wasn't a shampoo, but it was some kind of like oil to put on my scalp every, I can't remember if it was a specific amount of days, then stop and then do it when it flares up. But so can you talk about the type of prescription treatments that are out there? Because I'm sure there's quite a few.
There are. So I'll start with over-the-counter things because I know that, you know, I want to explain the full range of what's available. Okay. So the over-the-counter products are typically shampoos. They're typically antifungal. And you're probably thinking, why are they antifungal? So let me explain a little bit about why we sometimes use antifungal shampoos. So remember how I said seborrheic dermatitis is an inflammatory skin condition. And the reason why your scalp is inflamed, we think, is because it's an abnormal response to yeast that's normally on our scalp. So some people have an overgrowth of yeast, or even just a normal amount of yeast. And so for some reason, people with seborrheic dermatitis have this abnormal inflammatory response to the yeast on the scalp. And that's why we sometimes treat it with antifungal shampoos specifically. But I do want everyone to understand that it's not an infection. So you're not treating an infection. You're just lowering the load of yeast on the scalp so that you don't have this inflammatory response to the yeast. So does that make sense?
It does,
Yeah.
absolutely. Total sense.
So the over-the-counter products are antifungal shampoos, and one common one is ketoconazole shampoo. Sometimes they'll have zinc, sometimes they'll have selenium sulfide. They'll even have I've even when I had severe sebderm as a med student, I even tried a tar shampoo because that's also anti-inflammatory. But the antifungal shampoos can be effective, and the only downside for textured, coarse, kinky, curly hair is that they can be drying, and that's the number one complaint that my patients have, is that the over-the-counter shampoos might be effective, but they're not very cosmetically elegant and very drying to kinky, curly, coily hair. So for prescription options, in the past, we used topical steroids, and topical steroids are effective, but we all know we don't love to use topical steroids close to the face, right? Because they can cause acne and they have side effects when we use them on the face. So even though topical steroids were an option and are effective, they're not ideal, especially when you have involvement of the face or close to the face. So the good news is there is actually a very new treatment, and I'm actually partnering with Arcutis to talk about Zoryve, which is very exciting for me because this is a steroid-free option that treats the inflammation of seborrheic dermatitis. So it's a foam, it's once a day. It's alcohol-free, which is so important for texture hair. A lot of times scalp products that are created in dermatology have alcohol in them, which is not compatible with coily, curly, textured, kinky hair. So it's alcohol-free and it's once daily. And it works by decreasing that inflammation on the scalp. So I use it all the time in my patients. I have had great feedback. It works with all hair types, hair textures. And I'm very excited because it's the first FDA treatment in over 20 years. 20 years. Yes. Wow. That's why, as someone who had sebderm and, I have it, it's not flaring right now, but I have sebderm. It's crazy to think that there's been no new treatments in 20 years. So this is very exciting. So Zoryve, it's a once daily foam. It's alcohol free. You don't have to wash it out, because we don't wash our hair every day in general. Right. So at least I don't. So it's very compatible, and it's FDA approved for 9 years and up. So even in pediatric patients.
So you just put it on your scalp and you can comb your hair and go.
Cap, so you can put it in the cap or put it on your hand, and then basically part your scalp and part your hair and apply it directly to the scalp. In the clinical studies, it worked really well. 77% of patients were clear or almost clear at the end of the 8-week trial. And it was really well tolerated. The most common side effects were things like headache, nausea, common cold, just, common things, nothing very, very common in clinical trials. I do clinical trials for a living. That's one of the things that I do. So I'm used to talking about clinical trials.
Yeah, we love to hear about clinical trials here at blackdoctor.org. So, if you have any, and I guess that is a question, because some people are kind of leery of that. There's some that are ready and willing to try a clinical trial, but there are others that are a little kind of not sure if that's something they should do. So how would you kind of ease their fears?
So I would say that, first of all, they're so important, because if we don't have a diverse population in our clinical trial, we don't know if the drug works in all different types of people. So a big part of what I do and what I'm a huge proponent of is making sure we have enough skin of color patients in our clinical trials, because I want to make sure when something gets approved, it's going to work in my patients. Right. So it's so important. And, there's I know that there's a history of why some people are reluctant to participate in clinical trials, but there's so many regulations and things that really are there to protect the participants of a clinical trial. And I'm an investigator. So if you feel comfortable with your investigator, or the person leading the trial, that's another way to kind of increase your comfort level. But I always encourage people to participate, because if we don't have a diverse population in the trial, we don't know if it works for everyone. So it's really, really important. And I'm a big proponent of that.
Thank you. And thank you for sharing about the product that is steroid free, because I saw someone in the comments say they were allergic to steroids. So that was perfect.
Yeah, I love it, because as a derm, it checks every box. Because it's close to the face, it's steroid free. It's once daily, which is easier, because I never remember to do things twice a day.
Right.
So
Me either.
It's just easy. It's a lightweight foam that doesn't interfere with any hairstyle, and it's alcohol free, which is so important, and it's safe on color treated hair. If you chemically process your hair, it's safe. So for me as a derm, it checks every box, and most importantly, it's the first new treatment in 20 years. So for me, it's actually very exciting to have Zoryve to add to the things that I can use for my patients.
Now, what would you suggest using? We can go through over the counter, or if it's the same products for the eyebrows and around the nose and behind the ears.
So that's the great thing, because this product is steroid free, because typically, like I said, we can use steroids on the face, but we don't love to use steroids on the face.
Yeah.
And so because this is steroid free, it's safe. So it's safe to use on the eyebrows, on the nose, behind the ear, anywhere where you have seborrheic dermatitis. So that is one huge, huge benefit. And that's really why I'm excited, because it, like I said, checks every box for me as a dermatologist. Before, I would kind of have to say, okay, I might give you this topical steroid, but don't get it close to your face. I'm going to give you a different cream for here. I'm going to give you a different cream for, another location. And it can get confusing. And then people have multiple copays. It was complicated, and this kind of simplifies the process for me.
Dr. Heather, if you could see the box of creams I have in this house from all. So I love that this one will work. I love this. Bonnie wanted to know, where can she find out more info about clinical trials for this condition? This medicine is a prescription only, right?
It's a prescription only. And it is, so you'd have to see either your primary care doctor or your dermatologist to get the prescription. But in my practice, I've had very good coverage. So I've been very excited about that, because I am very personally excited as someone who has seb derm. Yeah. So I will admit, I'm personally very excited for this new treatment option, Zoryve. Now, the other question, what was the other question? I forgot.
To find out more information about clinical trials for this condition. Yeah.
So I'm not sure if they're actively doing trials right now on seb derm, but if you're interested in clinical trials in general, there's a big website. It's called clinicaltrials.gov. And you can always, for any condition, go to that website and type in what your medical condition is and see if there's any clinical trials in your area. So I always recommend that for people who are interested in learning about what's new. The great thing about clinical trials is you get to try what's new, what's innovative, what kind of solves all of these problems. Because as I mentioned before, for seb derm, we mainly had steroids, which were, not ideal for many reasons, because this condition is so close to our face. And we had these over-the-counter antifungal shampoos, which are great, but a little bit drying for, certain hair types.
Okay, perfect. Shelly Morris wants to know, what foods can cause inflammation?
I love
your
this
scalp
question.
or your face.
Shelly. So I am board certified in lifestyle medicine, and that's a specialty that focuses on how lifestyle influences chronic diseases. So the things we think about with lifestyle are diet, exercise, stress management. That's a big one, right? Sleep, which is an important one, which I'm not good at, I'll admit.
Neither.
Avoiding risky substances like excessive alcohol or smoking. And then the sixth one is maintaining positive social relationships. That's also very healthy for us. So when it comes to diet, for all inflammatory skin conditions, including seborrheic dermatitis, so acne, psoriasis, seborrheic derm, all of these inflammatory skin conditions definitely can be flared with diets that are high in sugar, because we know sugar increases inflammation in our body. Processed foods, we want to avoid processed foods at all costs. So for anything, for all of these inflammatory skin conditions, the best diet is that normal, healthy diet that we all know we should be doing, which is lots of fruits and vegetables, whole grains, no processed food. Those are the types of things that are good for our skin, good for our body, and also good for our skin, good for our scalp. So I definitely am a big believer in lifestyle and how it influences diseases, especially inflammatory skin conditions. So food, I think, plays a role, and stress definitely plays a role. So managing stress. I'll tell my patients, download a meditation app and just meditate for 5 minutes a day. You only need 5 minutes. It doesn't have to be this long, drawn out thing. It can be just quick 5 minutes guided meditation to kind of calm your brain down at night. So I'm a big believer in that.
I'm going to do that tonight and see if that, because I tend to think, oh, I've got to do 30 minutes or an hour. It'll put me to
No.
sleep, I think, but then I'm like, as soon as it stops, I'm up. But I'll try 5 minutes because I should be
Yeah,
able to
it
do
can
5
be
minutes.
overwhelming. And it's just,
Yeah.
so if you only have to commit to 5 minutes and you're just like, okay, but it's great because we don't turn off for even 5 minutes. We're
Right.
always like looking at our phone and looking over here, even at dinner all the time. So
Yeah.
just 5 minutes where you just listen to someone telling you to calm down can be very helpful.
It is. It is. I for a while, well, most of the summer, I was going to a meditation class where, because I was like, everybody's in there. We're all trying to we put our phones up, turn them off in 30 minutes. And it was so helpful. I need to go back, but it was so helpful that 30 minutes before my yoga class. It was like the perfect, like back-to-back stress reliever. And now that I'm saying it out loud, why did I stop? I need to go back
You need
to
to
meditation.
go back. You probably have less seb derm in the summer.
Right, exactly. And I will attest to the diet that you were saying, that the making those changes on what you're eating. I've cut out a lot of things, and my skin is looking a lot better. I can tell if I ate something I shouldn't have, like those Oreos the other day. It'll flare right up,
okay.
and then I'm like,
every once in a while, the 80-20 rule. 80% of the time, stick to the healthy foods. 20%, if you cheat a little, it's okay.
Yeah. Shelly also wants to know, are there certain products that we should not use on our hair to avoid this, or if it's avoidable?
So, that's a really great question. I think that, people who have seborrheic dermatitis were predisposed to it. So I'm predisposed to it, and it comes and goes. It can get worse with stress, as I mentioned. The things that can irritate, so anything that's too harsh. So anything that can irritate your scalp could probably aggravate seb derm. So I wouldn't want you to use, for example, and a heavy scrub. They're the new, like those granules or sandy scrubs that we use on our body. You wouldn't want to be scrubbing your scalp, scratching your scalp too much, or using products that are too acidic or too alkaline. So you really want to use products that are designed for the scalp, designed for a healthy scalp, designed for a healthy skin barrier. That's really important. So I would stay away from anything that would be irritating, like acids or things that are too abrasive, mechanical scrubbing. Scalp massage is lovely, but not where you're really scratching and scrubbing.
Yeah. Well, that brings up another question, because and I don't know if anybody else has had this happen, because I decided to get braids for the first time a couple of years ago. I was going to the beach, decided to get braids, and it itched so bad, like my friend was saying, mine doesn't itch like that. And so I went to the beach, and the whole time I was miserable, spraying anything I could find on my scalp. And when I got back and got to the hairdresser, she was taking it out, and she was like, oh my gosh, like your scalp, it was like red.
I'm
And
so sorry.
yeah. So I don't know if it was allergic to the hair, or if it was just the seb derm was angry.
So it could be both. That's a really good point. So people with seb derm definitely can flare with braids, because the hair that on a normal healthy scalp wouldn't maybe interfere with that scalp. If you have seb derm, that artificial hair could aggravate your scalp, because your scalp is a little more sensitive at baseline. So I think it could be a combination of both, that you had seb derm, maybe they were a little bit tight, so you had a little bit of traction, more traction than you were used to. Your scalp was exposed to the sun when you're at the beach, so normally your scalp isn't exposed to the sun. You might have gotten even a little sunburn on your scalp.
Mhm.
So all of those factors could have contributed, but I've definitely seen my patients who have seb derm who say when they get braids, it can aggravate it because, hair
Mm.
can sometimes be irritating.
Yeah, my hairdresser said, no more braids for you.
Exactly. Yeah. Yeah. Not everyone, but for some people, it definitely
Yeah.
can make it worse.
Yeah, yeah. Shelly also wants to know if this condition is hereditary, because she believes her mom always had an irritated scalp and used she says special shampoo.
I love that special shampoo. So it can, I don't know if it's clear that it runs in families, but I do think that almost everything is a little bit hereditary,
Mhm.
So with things like psoriasis, it's very clear. Those are autoimmune conditions that definitely runs in families. Eczema is another one. Very clear, not autoimmune, but definitely runs in families where people will have eczema, will say, oh, my sister has asthma, my daughter has hay fever, and it definitely runs in
Right.
families. But so seb derm isn't so clear that way, the way other skin conditions are. But I do think in general, things do run in families. That's just how, medical conditions are. So it might not be so strongly genetic as other skin conditions, but I definitely think it can run in families.
Okay. Guys, we have a few more minutes, so get those questions in. I was curious because as we're going into the winter months, and of course, it's, for those of us that have, it gets colder and weather is drier outside. How can we are there any preventative measures? I know we mentioned, some lifestyle changes, but is there anything else, like maybe when you're going out, if it's, I don't know, below 50 degrees or freezing, or if it's snowing, or if you're lucky to have snow in your area, is there anything to protect your face or your scalp?
So definitely for the scalp and the face. So that's a good point because we've talked a lot about the scalp, but remember seb derm can also happen on
Yeah.
your face. So really good moisturizers, really maintaining your skin barrier, using moisturizers that have ceramides, hyaluronic acid, things that really will nourish your skin are really important in the winter because you might need a different moisturizer for your face in the winter than you would in the summer. So that when we're thinking about facial skincare, you might want to switch your moisturizer, make sure you're using a gentle pH balanced cleanser. You might want to be really careful, with that wind, when the wind, I'm in
Yeah.
Miami, so luckily we don't have to deal with that. But,
Lucky.
I lived in a cold climate. I lived in DC. I went to college in DC for 4 years. So I remember what it's like when the wind is like whipping.
Yeah.
So really we want to protect your skin. And then as far as the scalp, we really have to focus on good scalp health too. So you want to use moisturizing shampoos, hydrating shampoos that really are great for the scalp barrier too.
Mhm.
So that's something that I think is really important. We never think of our scalp health, right?
Right,
We think about,
right.
oh, I need to put on some moisturizer. I'm going to protect my skin. But think about, we don't want shampoos that are really harsh, that are going to strip the natural oils from your scalp, because that could aggravate it. And we want to stay away from acids. There are things on social media that people are doing and they're saying to put acids on their scalp and so forth.
Oh,
For
yeah.
with someone with seb derm, that would make it worse. So we want to avoid things that can alter the skin barrier of the scalp.
Okay. And what do you suggest? Because I always would fight with my dad about wearing a hat when it's cold outside. I still do.
Yeah, I think hats are helpful, especially when it's windy and the wind is whipping through everything. Definitely.
Okay. Okay. Oh, I can't believe this conversation has been so great. But I have one more question that I ask all of my guests. What feeds your soul?
I would say nature absolutely feeds my soul. I live in Miami, as I mentioned, and
Mhm.
I walk outside every single day, usually twice a day, just to be outside and, look at the trees, look at the water, look at the birds. I think that that's so helpful. And from a science standpoint, we know that being outside in nature lowers inflammation in our body. Studies have shown
Mhm.
that, right? So
Yeah,
I think for me, being outside in nature is what feeds my soul.
I love that. I did want to ask real quick about let me scroll back up here to find it. Derm Friends. How can
Yes.
people find that? And can you talk a little bit about it?
Sure. So I created a platform called Derm Friends. I love to talk about skincare. You can tell I'm really excited to talk about what's new in skincare and skincare education. So it's dermfriends.com. And so anyone who's really interested in learning about skincare, you're either a skincare enthusiast or you're in the industry and you really want to learn more, I have a weekly newsletter. I talk about what's new in skincare, and I also on the website make recommendations for common skin conditions. So if you're looking for a good shampoo or a good moisturizer, but you have redness or you have something else, I try to recommend things that typically dermatologists recommend for common skin conditions.
Okay. And is it just dermfriends.com or is it an app or?
Dermfriends.com.
Okay, perfect. As I'm
Yes.
going to sign up for sure.
Yay.
Yes. Yeah. So thank you so much, Dr. Heather, for this amazing conversation about Seb Derm. And thank you to my co-hosts in the chat. They have really asked a lot of great questions. I'm
Thank you.
so
Thank you so much for having me. This is such an important topic, and I'm so glad that we're raising awareness.
Absolutely. And everyone, for more information on all things skin health, you can head over to blackdoctor.org for articles and resources. And I will see you guys next week for a celebration. And joining me will be Dr. Deanna Brown Thomas, the daughter of James Brown, and she's going to chat about living with heart failure. So make sure you come back next week and have a soul-filled rest of the week. Thank you, Dr. Heather.
Thank you.